So we'll talk about the key principles around person and family-centered care. We'll talk about the benefits. And then we'll also added in the component of action planning. So I used action planning in my family navigation, my other component of my job role, and we'll explore that. So these are the 4 principles around family-centered care. And this is how you make care meaningful and valuable to families. And then I also want to say the Institute of Medicine defines person-centered care as providing care that is respectful of, responsive to individual patient preferences, needs, and values, and ensuring that the patient values guide all clinical decisions. So I have a kind of cartoonish little cute video about patient-centered care. So we'll take a moment and look at that, kind of set the tone.
Today, we're going to talk about person-centered care and what it means to all of us working in healthcare. Where we once referred to patient-centered care, this has now evolved to person-centered care. Person-centered care recognizes that patients are people first and should not be defined by their disease. A person-centered health system helps people make informed decisions about managing their own health and care. It recognizes that the person's experience also takes into account their family members, caregivers, and providers. It includes deciding when to invite others to act on the person's behalf. And most of all, it acknowledges that a person lives with their condition 24/7, 365, not just the time they're seeing the healthcare team. There are 3 desired outcomes of a truly person-centric system. They include 1. A better overall experience with the healthcare system. 2. Greater satisfaction with the quality of care. 3. Greater likelihood of better health outcomes. This requires everyone in healthcare services to work in partnership to deliver care responsive to the person's individual abilities, needs, preferences, and goals. To achieve a person-centered approach to care, we need to promote patient engagement and activation. Activated patients are armed with the skills, knowledge, and motivation to participate as effective members of the care team to the extent that they are willing and able. An outcome of engaged and activated patients and caregivers is an improved patient experience. Now, not everyone in healthcare works directly with patients. If you don't, you may think that person-centered care doesn't directly apply to your work. But keep in mind that in a person-centric system, patient experience is defined as the sum of all interactions. These interactions influence patient perceptions across the continuum of care. They can be classified into 6 domains. 1. Respect for patients' preferences. For example, were family members in care? 2. Coordination and continuity of care. For example, did the patient know the next step in their care or who to go to with questions? 3. Emotional support. For example, did the patient receive the information they wanted and needed on emotional and relationship changes? 4. Physical comfort. For example, was the patient given enough information on possible side effects and how to handle them? 5. Access to care. For example, what was the patient experience with their wait time for treatment? 6. Information, communication, and education. For example, were tests and treatments explained so that the patient could easily understand the results? Did the patient receive enough information to make informed decisions? So think for a moment. Does your work have an impact on any of these 6 domains? Could a more person-centric approach in your work take patient preferences into greater consideration? Could you take steps to improve the person's coordination and continuity of care? Are you in a position to provide more emotional support or physical comfort? Could you provide more information that the person or their family may find useful? Bringing person-centered care to life is really about identifying key behaviors that can be embedded in daily routines. It's about breaking down the checklist into a few manageable items that can be incorporated into your delivery of services. To be person-centered is the responsibility of everyone whose role impacts or interacts with patients and their families. It's a lot to think about, knowing how to shape each and every interaction so that it contributes to person-centered care. This is where our person-centered care guideline comes in. This guideline has been developed with the essentials that we must do with each and every patient. It includes 1. Knowing the patient as an individual. 2. Understanding the essential requirements of care. 3. Tailoring healthcare services for each patient. 4. Continuity of care and relationships. 5. Enabling patients to actively participate in their care. By following this guideline, you will see a patient as an individual and focus on the whole person within the whole healthcare system. We all take pride in our healthcare system and care about our patients. This guideline will help us deliver the type of care we want and make Ontario's health system the best in the world.
Okay, so now we'll start into those 4 domains. The first one we'll talk about, or I will talk about, is dignity and respect. And so thinking about, I love this graphic because it really brings balance to the provider and to the family. And I think about my role as a family navigator. I see navigation as a great balance to the clinical side. So as much as Children's is chartered with finding a diagnosis or ruling out a diagnosis, they're here to provide family support. And I try to promote that idea across the division. So thinking about the medical professionals bring their expertise, but the family is an expert in their child. And we should always recognize that and value their input. So I think about you need to have awareness that we each, both the family and the professional, bring their own worldview, all their cultural beliefs into their interactions with families. So we need to acknowledge that and have awareness of that. And there's beauty in there. There's also room for growth too. So I think I love quotes, and one of my favorite quotes through navigation I found, and it says, a parent's perspective is more important than the child's actual disability. And I think that goes a long way. And I think that as providers, you have such a great opportunity to help shape the trajectory of families, thinking about, if you're really going to take them from maybe a challenging point when they receive their diagnosis and send them on an upward path, or if they will, kind of glide or glide down. So I applaud the fact that you have a place of power and really inspiration for families. So the next thing I'll talk about is active listening. I will assume that many of you have had some coursework in this already, but always a good place to have some review. It's such a big component of family and patient-centered care, but oftentimes with busy schedules and commitments, it oftentimes gets overlooked or doesn't have the attention that it needs. And so I think about many things can be acquired through active listening. You can have them obtain their important medical information. You can hear about family concerns. You can learn about the beliefs of the families, any cultural things that are important with the care. And you can determine barriers to care. And I often have said to others through my navigation work that if you're intentional with your listening, the families will most often reveal to you what they need. And so you'll build up a relationship. And obviously these things take time. They're not something that maybe the initial appointment you get that, but through your connections with them and just seeing their growth and your growth, you'll hopefully learn a lot about each other. So active listening helps you to determine their health literacy level, whether you'll need to make some adjustments to that. And it shows your compassion for the family. And that's how you build trust with them, is through listening and they feel like you value them and you care about their care of their child. So often with active listening, there'll be non-communication that goes on, and this could be making good eye contact, facing the family. And I always think if possible, I know it's often looks like a great time management thing to be typing as the family's talking to you, but I think sometimes if you're able to build in some pauses where you're just physically present with them instead of trying to capture the notes that you need to, but like anything, there's always a balance to that. We think of nonverbal communication, verbal communication being like reflecting back what they've said so that there's clear understanding of what they've tried to convey and that you yourself understand what they've shared, but also they'll know that you actively and listen to what they had to say. This will give you an opportunity to, acknowledge any difficulties they're having, overcoming barriers. I have another cute video. This one's from, I will assume most people know it, Inside Out. And it shows Bing Bong being very upset about something. And it shows joy and sadness, how they responded in different ways to the what's upsetting him. And so one is an excellent capture of active listening and mirroring back to someone, and then the other one, not so much. So we'll watch this.
No, you can't take my rocket to the dust! Riley and I are going to the moon! Riley can't be done with me.
Hey, it's gonna be okay. We can fix this. We just need to get back to headquarters. Which way to the train station?
I had a whole trip planned for us.
Hey, who's ticklish, huh? Here comes the tickle monster. Hey, Bing Bong, look at this. Oh, here's a fun game. You point to the train station and we all go there. Won't that be fun? Come on, let's go to the train station.
I'm sorry they took your rocket. They took something that you loved. It's gone. Forever.
Sadness. Don't make him feel worse.
Sorry.
It's all I had left of Riley.
I bet you and Riley had great adventures.
Oh, they were wonderful. Once we flew back in time, we had breakfast twice that day.
Sadness.
It sounds amazing. I bet Riley liked it.
Oh, she did. We were best friends.
Yeah, it's sad.
I'm okay now. Come on. The train station is this way.
So I think about, I'll ask a few questions so I can get a little interactive, not just me discussing it. So I'll ask who was showing active listening skills in this video? Yeah. Thank you, Zoom land. How could you tell that they were having active listening skills?
because of the response that she gave, she understood that he was feeling sad because he lost something that he loved, versus where happiness was focused on trying to solve the problem without really hearing the whole problem.
That's perfect. Yeah, I was thinking as I watched it was though she was just pelleting with like suggestions and strategies and trying to change the situation instead of just being present with the pain and acknowledging it. Thank you. So lastly, so I guess you answered both of those questions. Sorry, when capturing with your answers. So we said that why she wasn't helpful.
I'd like to add something.
Yes, is this
Um,
Talika?
Yeah, I think this is a very good example because I personally experienced that sometimes I'd like someone to acknowledge my challenges rather than telling me that I'm a super mom and I can do this. And I mean, you are so positive and things like that. Take everything in a positive way, because sometimes it's important for others to listen and not, when I'm talking to someone, I'm not always looking for solutions. I'm talking to someone so that they can listen, and I just have a maybe sounding board or maybe just a shoulder to cry. When someone states a problem, it's not always for solutions. Sometimes it's because they just want to share what they're feeling. So acknowledging someone's challenges is not always a bad thing. It's just as much a support as saying that they can get through it. So I think this is a wonderful example of that.
Oh, thank you. And thank you for sharing your own personal feelings on that. I will also say, add into that what Talika said. So I think as this is in my parent role, I feel like when people say, oh, you're amazing, or you're a saint or whatever, that I'm doing something that I shouldn't be. You know what I mean? Like I should like water it down, or you know what I mean? So I think it's all well intended, but I can see sometimes that's just not very helpful, and it's uncomfortable for the person that's receiving that.
Can I add something
Yeah.
to Talika's point? So I think, like I was talking about this with my supervisor, is that as clinicians, we're just very goal oriented, like getting through the appointment or getting through the diagnostic interview. But sometimes we have to be flexible with our goals. And like in that moment, the goal is to like actually hear and listen to what the patient or the family member is saying, so that you can be like more productive for like the overall goal of getting through the appointment.
Mm-hmm.
Sometimes taking that side step is more efficient.
And then sometimes you might find out what their priorities are.
Mm-hmm.
And then by finding out what the family's priorities are, then that will help increase your odds of getting goal completion. Thank you for sharing that. Zoomland and Lisa, thank you. And feel free to interject at any time, or if you have a question, just stop me. So don't feel like you have to leave your questions to the end. I'll ask now, does anyone have any questions before I move on?
Well, I also kind of like to also agree with Talika in saying that no one likes to be able to have their like challenges sort of judged in a way like when I was still working at Office Depot, I had a couple of customers ask me, oh, hey, that's pretty cool that you they're able to communicate. You doesn't really seem like you're autistic. Like that doesn't really make me feel like how I how I present myself as a person with autism makes me feel better about myself. So while with Happy's with how Happy is trying to communicate with Bing Bong, while it doesn't necessarily seem like she has impure intentions behind it, I feel like with people go through certain challenges, they kind of need to be able to have sort of a more understanding outlook towards how you communicate with them. So yeah, I definitely support everything that Talika said about the whole thing.
Thank you for your valuable input
can
and
I-
insight, personal insight. Go right ahead.
Can I add to that?
Yes, certainly. All comments are welcome. I'm happy to anyone sharing.
I just wanted to piggyback off of what he just said. Sometimes when someone is saying, oh my goodness, you did that great, or this is good, it's almost like you didn't expect that person to be able to excel or do that because of their disability. And it's so people are trying to encourage you. It kind of takes away, it's almost like an oxymoron, because it's like, okay, yes, I have a disability, but why are you surprised that I can hold a conversation?
Definitely. So I think about when my daughter was in school and I would hear someone say, oh, she surprised me with this or that, skill or ability. I'd say, well, I'm glad she demonstrated that, but then that means that your bar is set too low if she's surprising you. So thank you. Is there any other comments before we move on? Great. So our next slide we'll think about as far as dignity and respect is these teach back and show kind of, I think that's very much important for families. I found a research study from the Agency for Healthcare Research and Quality, and it showed that 40% of medical information that patients receive during a visit is lost immediately, forgotten immediately, and nearly half of the information is incorrectly retained. So I think those are pretty startling statistics, but so with that thought, as many times as we can imprint our recommendations or thoughts or follow up on them, the better success for everyone involved. I think of one of my main intentions with family navigation is helping families to think about being more proactive than reactive. And so thinking about potential hurdles or just things that you can put in place that will enhance a situation and make it more fruitful. My chart is a great way to get families to be able to connect easily to their provider. I know sometimes there's a little bit of logistical hoop at first for families to sign up, but once they do, it's a really good way to get information back and forth. And I think it builds on that idea of empowerment for families. So that's something that as you go through the process, many times coming out of the diagnostic phase, you feel powerless and you feel alone. And so through family-centered care, there's just some ways to combat those feelings. And any tools that you can provide to families, whether verbally or a written way, so that they can gain that sense of power and autonomy will be so beneficial. And then they'll just continue to build on those skills. I think about the feeling that you're experiencing something that no one else is, or very few. Figuring out ways that you can connect families to others that can, help with that sense of loneliness. And then also that idea that you're there, as I said before, about family support and the important value that Cincinnati Children's plays in that. And so then we think about the active listening playing into the idea of the health literacy level and just being able to be mindful and some verbal, nonverbal cues from families, whether they are understanding the information. So next we'll talk about cultural awareness, which is vital to quality healthcare. There'll be throughout the year lots of moments to bring you back to cultural awareness and exploring it. So cultural awareness respects the diversity of the populations that you serve. There can be cultural things that affect their care, such as language, communication style, beliefs, attitudes, behaviors. So there's a lot that goes into thinking about that. But not only is it going past just understanding of families' cultural awareness or cultural, it's embedding that into your plans, your care plans for them, and thinking about how do you take that knowledge and activate upon it. So research shows that patient care that is culturally aware leads to more successful and beneficial outcomes. But cultural awareness takes some self-reflection, which you'll get plenty of that throughout your Len year. And so you'll come to understand your worldview and how that shapes how you interact with others. So next we'll think about, keeping an open mind. Another way to think about that is suspending judgment, which is such an integral part in the navigation work that I do. I think about if I don't suspend judgment, then I can't provide the best care navigation services to families. Families might have a different belief system than I do, or a different style of life, but that's all pushed out, knowing that I'm focusing on them and what their needs are and how I can best serve them. You practice dignity and respect by putting your thoughts and beliefs to the side. Obviously, never ignoring anything that's concerning. I know they've talked to you about, the mandated reporters and those kind of things. So I don't want you to think that by saying that, I'm ever giving you, allowing you to have an unsafe situation continue. That needs to be, someone needs to be notified of. I respect that it's a difficult thing to do, to sometimes suspend judgment, but it's necessary to build that trust and get your family to feel open and comfortable with you. I'll stop a moment to ask if there's any questions or any comments that anyone wants to add. So I guess what ties into that easily too is the idea of honesty and the importance of honesty, and that really builds that trust between the provider and the family. And as I said before, about trying to build their autonomy and letting them get their power back, build their skill base, and keep building on their skill base. And it allows them to feel, comfortable and confident with you, so that in times of need, they can reach out to you because you have built that trust with them. So next we'll think about information sharing in action. So really important to have clear and concise next steps, but also confirming understanding. So making sure they understand their next steps. So in a little bit, I will show you an action plan that I've used in the past. It's a bit formal. We use it in a research study. But I think really getting in simple terms on how you can take the information that the family is to receive and how you can put it in actionable steps. Communication can be in a variety of ways. It could be verbally, it could be written. As we can see from the research study that I quoted, a lot is lost verbally, but so written format's important. I think if you have a long report and your next steps, recommendations are at the end, maybe if you can, circle that or something to draw them back to that. So when they go home, they'll know where that is. I think it's oftentimes you get a 20-page document and then you're like, okay, in there somewhere is what I need to be doing. So kind of some way to draw their eye to that or putting it on the very top. Many times families will feel overwhelmed. And so sometimes we'll receive referrals to family navigation to kind of follow up with the family just to see how their next steps are going. I know there's only so much time in the day. And then I also know for providers, maybe that's sometimes not your role. It's just to provide this and be done. But if there's a possibility for you or someone else in the division to follow up with that family to see how they've processed the information, how they feel about moving on with their next steps. Next steps are sometimes trip up families as far as who to contact, how to, where to go for information. And so just that little extra information sometimes makes all the difference. I think about providing information in timely fashion. Unfortunately, sometimes there's a delay between the diagnostic process and the information sharing. And that's, anxiety producing from the family because they want to know what the diagnosis is, if there is one, and how they might move forward. And so that lull time in there is difficult. And then, yes, go right ahead, Talika.
Sorry, but I feel like I just needed to stop right here and just mention something that sometimes too much information, as you're mentioning, is no information at all, because it gets too overwhelming. And as a parent, I've realized that then I end up just not knowing what to do next because there's so much information and I'm confused now and overwhelmed. And I feel like if we had a system where, well, I have a science background, so maybe that's how I think, but something like a flow chart, like you are here, next steps, like what to do. Okay, search for a provider. So for that, go to page 5 of the sheet. Yes, no, like a flow chart, so that we can see visually what are the next steps, because just too many words on too many pages, and then I'm kind of lost and overwhelmed just looking at so much. So like more visually, if we knew what are our next steps, and then if yes, then what, if no, then what, and then you don't have to have all that information there, but if no, then go to page this for these many options. If yes, then go to page this for these options. I feel like that would be so much more helpful in understanding how to go forward than just like pages and pages of just literature for us. Just something.
Hey, that's an intriguing thought. I've never thought of it that way. I have to explore that in my mind, and we can talk about that some more as we work together as family specialists and trainees. I think I've seen many providers put it in a 1, 2, 3 format, some more concisely than others. So everyone has their own style, and I respect that the division allows that individual freedom in creating their notes. I'm not sure. Sometimes as a navigator, I think it'd be best if they could collaboratively get together and figure out the best format, maybe with some input, and get some consistency with that. But yeah, I think our brains are all evolving too with all the technology that we've been part of now for a couple of decades. I think people are not able to look at things as long as they used to be able to, or process them, and everyone wants information in a quick format. Thank you for sharing that. Go right ahead.
Just to piggyback off of what Talia said, do you think that maybe even having a conference or a talk about certain things that you want to get information on, maybe like an email with the doctor before we come in saying these are the things on, so that there's not information overload, so there's not a lot of things that maybe we don't need at that time, so we're not just getting a whole bunch of information just to have it? Would that kind of help the patient and doctor relationship of trying to figure out the things that are really needed?
So are you meaning like them kind of prepping you for the appointment, or the reverse? Wasn't sure. There was a little bit of cutout as you were talking.
I'm sorry. I'm meaning the reverse, like the parent maybe outlining the things that they're concerned about in the behavior, so that when we attend the appointment, one, it can go smoothly and it's time efficient. And two, they'll know exactly what we're looking for. So we're not just kind of pulling stuff out the air, because I think when you have more time to think about what you need and what you want before the appointment, instead of being in the appointment, you'll be able to have more data and more information. Because sometimes I think when we're in those doctor appointments, we forget certain things that we might want to talk about because the doctor has brought up some other things too.
Yes, so I think that's a great point. I think always preparing your thoughts ahead of time, whether it be a doctor's appointment or a school meeting, is a great idea. I'll ask Jen that thought. So Jen, do you try to draw your attention away? I think about, as a provider, would you like for one of your patients coming in to kind of prep you a little bit on what their current status is and what they're wanting to discuss in your upcoming appointment? Or is that even something that goes on, or a possibility?
I think it is definitely from a treatment standpoint. I think from a diagnostic standpoint, like that's one of the first questions that we ask for sure, is like, what
Concerns?
What are they seeking,
Mhm.
you know, by coming into this appointment? And what answers, or like what things do they hope to explore? And then same thing, actually, from a treatment standpoint. So I definitely think that that's the practice that we have here.
Mhm.
You know, is that we do like as much preparation as possible. And sometimes it's through chart review that we do that. Other times it's in those conversations.
Yeah, and I think too, maybe that's where my chart message, a short one, not something excessively long, but yeah, you could put your concise thoughts in there, and that would be a nice tip off. The provider would probably could see that right before your appointment, and then make the most of your time together. So thank you for that suggestion. Is there anything else as we move on? Thanks for all your valuable input and personal testaments. It's really adding a lot to my presentation. Thank you. So next I'll think about cultural awareness. So family dynamics and cultural awareness. So might have to think about different things as far as like travel, the distance that the families have to go, or do they have easy access to services? And if not, thinking about how do you work through those barriers and make it more of an option for families? Are they possibly caring for multiple children with disabilities, or just have several young children at home and having to divide their attention and making sure everyone's needs are met? Are they a non-English speaking family? So will you need to get your reports or recommendations translated for them? So some awareness that was built in for me is thinking about, you know, the interpreter is someone that would be part of like in person, or could be on a phone call and using interpreter services. Translator would be someone you'd utilize for, you know, written documentation. And also within this family dynamics, cultural awareness would be, do you detect any mistrust of the healthcare system? And so this is where your active listening, showing empathy, and just really being present with the family, you may be able to pick that out. And if so, you know, how you might work through that and reshape that, hopefully in a positive way. So next we'll think about care decisions. So this would fall under participation in action. So you always want to view the family as part of the care team and really feel their value in being part of that care team. Respect that therapy recommendations can, you know, add stress to the family. So there's going to be time involved getting there, arranging them, managing if you have other children. And then, so we're thinking about travel and time commitments, and then family dynamics. So sometimes all of those come together, and then you have to prioritize what recommendations are going to go first. And so working together to find out what the family really thinks is most important. And might not always align with what the provider thinks, but hopefully somewhere you can come to a happy medium. And this partnering with families gives the best success chance of, follow through on recommendations, the child building skills. So next we'll think about barriers to care. So who's less likely to receive family-centered care? Unfortunately, potentially people with disabilities, families of color, lower income families, lower health literacy, families that don't speak English. So I think of in my role as a family navigator the last couple of years, I seem to have had an increase in families that speaking languages other than Spanish. So I think about how many tools now are in Spanish, and then there are groups that bring together Spanish-speaking families. But now I'm having, just a variety of unusual languages, and I think about how frightening and how challenging that must be for those families. So they have not only the language barrier, and they with their child with a disability, trying to access services many times in a provider base outside of children's that's not able to accommodate their needs and their language needs, and just trying to help them get enrolled in preschool, something that is so vital for them. But there's a lot of paperwork involved in that, and there's a lot of steps with that. So one of my personal goals as a navigator has been, or work goals has been to, how do I serve better those families that don't have English as their native language? So I'm really thinking about that and how you work around that challenge. So I'll ask you, so we can get a little bit interactive. Why do you think these groups experience barriers to their care? Can you think of some other things or other ways that they're challenges? Yes, Katie.
I know for some of the families that I work with, they don't have transportation or the money for gas. Like they might have a car, but it's like I can either pay for gas in the car or we don't have transportation. So I think that that's a big thing that affects participating in outpatient or families coming to visit kids when they're in the hospital too. And I think the hospital, when they know about it, tries to help with that if possible. To try to get them an Uber or a gas card or something like that to take care of that barrier.
Yeah, some really hard choices financially. So I think of this morning, Michelle and I got on the elevator together. Someone was on 3 and they were unsure where audiology was. So we were directing them to what floor to get on. 2 little cute boys in tow. But she shared that she had come from Newport. She'd ridden a bus. So her morning was already very full. They were, managing them and figuring out how to get here and getting here in a timely fashion, going to a building that she'd never been to. And so hopefully, everything went fine. She got where she needed to be. It looked like she was. And so thinking about that, I know.
She was all good.
Oh, great, Griffin. So you know who I'm talking about. Awesome. I'm glad you crossed paths with her.
Like, this sounds familiar.
Yeah. Very nice. I had met someone who spoke at our church one time. They were here in town for their child. I was ill. For whatever reason they were staying, I guess that's where they got lodging. Maybe they're Kentucky residents. They were walking, my church is in Covington, and they were walking every day all the way from Covington to Children's to visit their child. So my church was getting them connected with, an agency that could help provide them some transportation, but that's what they were doing. And that just, they were facing that challenge, but you think, oh, there must be a better way. So, so any other thoughts on challenges? I think about maybe less access to care in general, maybe the community that they live in. There might be high volumes in that wherever they do seek out healthcare, might be a lower staffing there. Maybe the providers aren't as well versed in cultural humility awareness as we get here. Maybe don't have the translation services that we've talked about. Maybe don't have communication needs. So I think about my own journey with my daughter who has an augmentative AAC device. Even sometimes when we come to a children's satellite, they're not always as natural or engaging as one would hope. You know what I mean? So we kind of use it as a teachable moment and trying to get her autonomy and thinking about being her own voice. So collaboration kind of ties it all together. I call it cross-pollination, and I always try to do that the best of my ability. When my daughter was getting services scattered, it's somewhat easier if you're getting them in one location, and the hope is maybe the therapists are talking at other times. It assists families in identifying their next steps and makes valued partners of everybody that's in the collaborative team. And then I think about it's really important to impress upon families the importance of carrying recommendations across all the settings. So it'd be home, school, community, just for better embedding those skills. And then in the end, hopefully it enhances the empowerment and confidence and skill building in the family members. So this was, I had referenced this earlier, this was an action planning tool that I used in the research program. I carried that forward, like in family navigation workshops. We used it at a conference for an Empowering Families Symposium. So just thinking about getting families to just narrow down their focus, you know, to a goal, and then narrowing down what are your steps to reach that goal. And often I would have families, if it was like to call so-and-so, I would have them actually put the telephone number on that line, just kind of making that window, you know, just tightening that down to thought to activation, which I have to do for myself all the time. And then always knowing that, keeping in mind that the goals are family driven, obviously should probably springboard off of the provider recommendations.
Elizabeth.
Yes.
I also wanted to add that, you know, when we say, sorry, that's my son. When we say
That's
that
fine.
we need to collaborate, it is also incumbent upon the family to be just as active in providing information and I call it support, but some kind of, you know, support for the care, for the provider as well, so that they can understand the family better. So it is not a one-way street. It is a two-way street where the collaboration is between the family member and the provider. So it is the responsibility of the family member just as much to provide as much information. Sometimes providers might not know what questions to ask. So it's always a good idea for the family to be actively involved just as much.
Very nice. So I think this was all on one sheet. So obviously I've divided into different slides. So in addition, I think as far as identifying your goal, but what's going to maybe make it difficult to reach your goal? So many times it was time for families. And then maybe finances or logistics. So just kind of identifying those, you can think about strategies around them possibly. And then thinking about how comfortable you are with that goal. So I think this is really important to think about that. So obviously the higher the number, the higher the success that they can obtain their goal or work on their goal. So, and then a part of the action planning was to follow up with the navigator, or whoever you've made this action plan partnership with, and thinking about I found that families thought, oh, well, someone's going to hold me accountable for that. So we would, they'd fill out the sheet in their own handwriting, it was their document. And the hope was to, put it up somewhere that would be in front of you. And then we would determine what was the best way to connect. So these are some sample goals that families had picked. I'll give you a moment to look at those. Any questions regarding the action planning or anything we've talked about? So I think another big part of strengthening families is thinking about resiliency. And when I did family navigation workshops, I would integrate this and just kind of looking at strengths that they already had, building on them, or maybe awareness of other things that could help them be resilient. There was 2 slides of this also. So if anyone has any comments about them, please feel free to share. So the next thing we'll talk about is benefits for the individual and their family. So logically, the more you strengthen your families, the greater success you'll have with their next steps and strengthening the family overall. And then, as I talked about before, you have that great opportunity to really plot the trajectory for families. And then hopefully building skills that are lasting, and then they'll just continue to build on their skills. So I think about school advocacy as a perfect example of that. So families it's a very intimidating process. You don't need to know all the skills at first, but you just continue to build on them as you go. So next we'll think about the benefits for providers, which there are many. So it's really, a win-win situation for families when you have good family and professional collaboration. There's stronger relationships, understanding of needs of everyone, higher productivity, better job satisfaction, higher morale, and hopefully overall reductions in care costs. So next we'll finally move to a interactive. We're going to do some case studies. They were posted on Canvas, but I think we'll take our break now. I appreciate everyone listening to the presentation portion, and this might be imported into. They were imported into the Canvas. And so for those in the room here, we're going to divide up in groups, and there's 4 different case studies. And what I've also done is for those on Zoom, we've divided you up into 2 different rooms. And if you could go in each room, like say you can, there's one listed Ashley, each pick a different one. So one of you pick Ashley and one of you pick Julianne. And, or I guess, I'm sorry, room 1 will be Ashley. So the next thing we'll talk about is benefits for the individual and their family. So logically, the more you strengthen your families, the greater success you'll have with their next steps and strengthening the family overall. And then, as I talked about before, you have that great opportunity to really plot the trajectory for families. And then hopefully building skills that are lasting, and then they'll just continue to build on their skills. So I think about school advocacy as a perfect example of that. So families it's a very intimidating process. You don't need to know all the skills at first, but you just continue to build on them as you go. So next we'll think about the benefits for providers, which there are many. So it's really, a win-win situation for families when you have good family and professional collaboration. There's stronger relationships, understanding of needs of everyone, higher productivity, better job satisfaction, higher morale, and hopefully overall reductions in care costs. So next we'll finally move to a interactive. We're going to do some case studies. They were posted on Canvas, but I think we'll take our break now. I appreciate everyone listening to the presentation portion, and this might be imported into, they were imported into the Canvas. And so for those in the room here, we're going to divide up in groups, and there's 4 different case studies. And what I've also done is for those on Zoom, we've divided you up into 2 different rooms. And if you could go in each room, like say you can, there's one listed Ashley, each pick a different one. So one of you pick Ashley and one of you pick Julianne. And, or I guess, I'm sorry, room 1 will be Ashley, which is Greg, Laura, and Walia. And then the other one pick Julianne. And I'll go ahead and open the rooms for you. Do you have any questions before I send you on your way?
I just see a blank black rectangle on my screen on top of your slide.
I think that's probably because I haven't opened the rooms yet. And so I was holding them until I gave you directions on what we were going to do.
Okay.
So I guess if you all don't go where you're supposed to go, you can send us a message in the chat.
Okay.
So here we go. Do I also have to hit join, Jen? I'm not sure.
No.
It looks like they're getting in there.
Yeah, there we go.
Yep.
Okay.
So this is if you want to join
Okay.
in that room.
Obviously, you can tell, even though we've gone through 2 years of
Well, it's
pandemic,
different
I still
on
don't.
here versus.
Yeah. Okay, so for those in the room, I don't know if anyone, for our first sharing, we'll do a case study that was done in Zoom and then also in the room. So I believe you all had, so Julianne, is that right? So would you like to jump in with the sharing? So I thought if you could just give kind of a few details about the case study and then go through the prompting questions, and then we'll let those in Zoom that had that case study, they can add in too. Does that sound like a good strategy?
I'll get the. Oh, yeah, sorry.
Our case study was about Julianne. She's a 16-year-old with ADHD who came to DDBP for medication management. And while their parents were out of the room, Julianne told the doctor that they've been questioning their gender identity and they're concerned their parents won't understand. So then the doctor's like, what do I do now? And the doctor wants to refer them to the transgender clinic, but not sure kind of how to navigate that and keep kind of the confidential information that Julianne told them. That's the background of it.
Pass it to our lovely social worker, who's got to look out.
All right, so we thought like the first question of how to resolve or mitigate the conflict between the 2 important family-centered principles, that in this case, it was kind of focusing on patient first and patient's well-being, and to talk with Julianne about what she wants to do, what they imagine will happen, and kind of working through next steps with the patient. So while the family may not be included, we considered it mitigating by discussing how the family could be included, what that would look like, possible repercussions, and just kind of playing it out with the patient. And then basically that's the same for question number 2. And then for 3, Julianne's strengths were that we don't know pronouns at this point, so that they had trust in their provider to share the information, and also had great self-awareness to recognize this in themselves and to bring it up in a safe space. And then the behaviors that the provider could do are basically what we said, to put patient first, to not break confidentiality, and to support them as they make decisions about sharing with their parents or not sharing, and what that looks like.
Very nice processing of that and strategies and thoughts around that. Did anyone in the
people in the
Zoom
room come
group
back,
have
and
any
we're
input
going
that
to share some
spurs that
feedback
case?
from each of the groups.
Just one of the other things that we talked
and
about.
would
that they
love
might
to hear
do,
from the Zoom.
the provider has
group.
put a note
If-
into their chart or into their notes, so that when Julian comes back, they can continually recheck in and touch base with her. And hopefully that would, because we didn't want it necessarily in the chart, because then that would show up where the parents could possibly, see that information. So
Yeah.
we thought that might be a way to mitigate, the situation, the conflict, so, as it would be.
Very good. Anybody else in the room, even though it wasn't your case study, have any thoughts or besides what was shared?
We also
Okay, good.
talked
We'll move- Oh, go right ahead.
Oh, we also talked about in our group of that you might be the first adult that the patient ever tells this to, and trying to make it as positive as of an experience as you can, to help try to build their trust in being able to tell that information to others.
Yes.
One more thing that we talked about was also maybe referring the patient to the counselor at school, maybe starting small and then, not blowing it up, not making it too, not really making it a big deal, and starting it small, like, at the school level, trying to talk to the counselor and recommending not to the transgender clinic, but, starting at the school level, so that, there are baby steps towards final reveal, if I can call it that.